Vitamin E plays a meaningful and multifaceted role in supporting cardiovascular health, largely through its ability to reduce oxidative stress and protect blood vessel integrity. One of its most important actions in this regard is preventing the oxidation of low-density lipoprotein, LDL, cholesterol. LDL is often labeled bad cholesterol, not because it is inherently harmful, but because when it becomes oxidized, it triggers a series of inflammatory responses that can lead to plaque formation in the arteries. Vitamin E helps break this chain reaction before it begins by neutralizing the free radicals responsible for oxidizing LDL. This action significantly lowers the risk of atherosclerosis, the hardening and narrowing of arteries caused by plaque buildup, which is a major contributor to heart attacks, strokes, and other cardiovascular complications. Unlike water-soluble antioxidants, vitamin E is fat-soluble and thus ideally suited to protect lipid particles like LDL cholesterol. Once vitamin E integrates into the outer shell of LDL particles, it acts as a first line of defense against oxidative attacks. This protective effect is especially important in an environment where oxidative stress is high due to factors like smoking, pollution, poor diet, diabetes, or chronic inflammation. By keeping LDL particles stable and unoxidized, vitamin E helps ensure they don't become trapped in the arterial walls and spark the development of arterial plaques. Beyond its effect on LDL oxidation, vitamin E also supports cardiovascular health in several other important ways. It helps improve endothelial function, the ability of blood vessels to expand and contract efficiently. The endothelium, which lines the inside of arteries, plays a key role in regulating blood pressure, blood clotting, and inflammation. Oxidative stress can damage this lining and make it more prone to dysfunction, but vitamin E helps preserve its health and responsiveness, which in turn supports smoother blood flow and reduced vascular strain. In addition, vitamin E may have mild anti-inflammatory and antiplatelet effects. It can help reduce the stickiness of platelets in the blood, lowering the risk of inappropriate clot formation. Blood clots can obstruct arteries and lead to life-threatening events such as heart attacks or ischemic strokes. By mildly thinning the blood and improving circulation, vitamin E contributes to a lower overall risk profile for such incidents, especially when combined with a heart-healthy diet rich in fruits, vegetables, omega-3 fatty acids, and other antioxidants. There is also growing interest in the way vitamin E may benefit those already dealing with metabolic disorders such as hypertension or type 2 diabetes, both of which significantly increase the risk of cardiovascular disease. In these populations, oxidative stress levels tend to be higher and vitamin E's protective antioxidant role becomes even more critical. Some research suggests that maintaining optimal levels of vitamin E can improve blood lipid profiles, reduce markers of inflammation, and enhance insulin sensitivity, all of which are linked to better cardiovascular outcomes. It's worth noting that while vitamin E offers promising heart protective properties, its benefits are most effective when consumed as part of a balanced nutritional strategy. Whole food sources like almonds, sunflower seeds, hazelnuts, spinach, and avocado provide vitamin E in a complex nutrient matrix that supports overall heart health. Supplementation may be helpful in specific situations, particularly in individuals with deficiencies, elevated oxidative stress, or higher cardiovascular risk, but it should always be approached with care to avoid excessive intake. In conclusion, vitamin E is a valuable nutrient for cardiovascular protection. By preventing the oxidation of LDL cholesterol, supporting healthy blood vessels, reducing platelet aggregation, and minimizing inflammation, it contributes to the prevention of atherosclerosis and a lower risk of heart disease. These effects are subtle but deeply influential over time, especially in individuals committed to a healthy lifestyle and balanced diet. When integrated thoughtfully into one's nutritional plan, vitamin E can be a key ally in maintaining a strong and resilient cardiovascular system.